When it comes to your health, more medical tests, treatments, and procedures are not always better. In fact, sometimes they are unnecessary and could do more harm than good. The mission of Choosing Wisely is to promote conversations between clinicians and patients by helping patients choose care that is supported by evidence, not duplicative of other tests or procedures already received, free from harm, truly necessary.
Typically, when I'm talking with a family, a lot of it is a negotiation. So having people come in with some ability to be able to talk to me, discuss the pros and cons of different tests becomes really important in the way that we're going to manage their care.
Seeking information sources such as the internet, medical journals, things that they may have access to that can help educate them on the particular issue that they may have. And then also being involved with their physician. So making sure that they're asking their physician questions about their condition, their diagnosis, what the diagnosis means.
If one looks at the internet, they would gather certain types of answers for their questions. But they also have to remember that we have to be careful of the websites at which we look for information. And it's got to be a website with a good reputation.
As the national voice for reducing unnecessary tests and treatments in healthcare, Choosing Wisely Canada inspires and engages healthcare professionals to take leadership in reducing unnecessary tests, treatments, and procedures, and enables them with simple tools and resources that make it easier to choose wisely. It does so by partnering with professional societies representing different clinical specialties, like cardiology, family medicine, and nursing, to come up with lists of things clinicians and patients should question. These lists of recommendations identify tests and treatments commonly used in each specialty that are not supported by evidence and could expose patients to harm.
I think most of us look at radiological investigations, and a lot of people request them. For example, CT scans, MRIs, but I'm not sure whether people realize that a CT scan creates a lot of radiation. Should we really subject someone for a simple headache to a CT scan?
Overall, we know that with increasing volume of patients, there's increasing demands on the medical system. And ultimately, the goal is for us to be using our resources appropriately and most efficiently, and also to protect the patient. So we're trying to avoid doing additional tests that may not be necessary, that could lead to undue stress, and again, that could lead to further investigations that potentially expose the patient to harm.
Next time you see your doctor, have a conversation. Here are 4 questions to ask your healthcare provider. Do I really need this test, treatment, or procedure? Tests should help you and your doctor decide how to treat your problem, and treatments and procedures should help you live a longer, healthier life. What are the downsides? Discuss the risks as well as the chance of inaccurate results or findings that will never cause symptoms but may require further testing. Weigh the potential complications against possible benefits and the symptoms of the condition itself. What happens if I do nothing? Ask your doctor if your condition could get worse or get better if you don't have the test, treatment, or procedure now. Are there simpler, safer options? Sometimes lifestyle changes will provide all the relief you need.
Usually walking them through all the different options and explaining pros and cons of each. Having people be involved and participate and voice their fears and concerns becomes a really important part of offering people the best type of treatment for their family.